Thank you very much, Mr. Speaker. Since June, the Scottish public health-based tracing system has managed to trace 99.7% of positive cases and almost 99% of their contacts. Yet in England, the commercial Serco call centres have traced less than 60% of contacts. Can the Secretary of State clarify if there are any targets included in the £10 billion contract with Serco, and if so, are they being met?
Secretary of State.
Well, obviously, if I correct it, there isn't a £10 billion contract with any private company, but the private companies have been absolutely critical in the working of making sure that the whole testing system can be built at the scale that it has. And as I just said in my statement, the improvements are continuing, and we're seeing that local engagement, which is critical, and we're seeing the testing rolled out right across the UK. For instance, in the local outbreak that happened in Aberdeen over the summer, we were able to use the UK resources to get huge amounts of testing into Aberdeen, thanks to the collaborative work between the UK government providing the UK testing and, of course, the Scottish government who were responsible for the lockdown.
We now return to Dr. Philippa Whitford. Dr. Whitford.
That doesn't address the fact that the call centre system run by Serco has only managed to contact 60% of people's contacts. Regional Public Health England teams have been working flat out for the last 7 months, and they are tracing over 95% of the cases they deal with. So does he really think the middle of a pandemic is a good time to be threatening their job security with a huge reorganisation?
Well, the answer to the first part of the question is that, of course, when you're trying to reach scale fast, then we use the national system, but then that engages with the local system, as we were just hearing, for instance, in Croydon, so that you can then get the boots on the ground to find those contacts that can't be contacted through the national system. It's the combination of the two that actually works best. And as for making sure that our systems and our national systems are in the best possible place to tackle coronavirus going forward, I absolutely think it's right constantly to be seeking to make improvements to how this operates, and that's why I announced the changes that I did.
Is the Secretary of State aware that some people are being refused home testing kits because the credit-checking company TransUnion hasn't found their names on the public version of the electoral register? Can he explain why he contracted this American company to verify people's identity and what he'll do to resolve this issue? He still hasn't addressed the poor performance of Serco, who have failed to trace 40% of contacts and apparently didn't even have contact details for over 2,500. This compares poorly to the public health-based systems of the devolved nations, which are managing to trace 90% or more. So instead of breaking up PHE, will he not provide them with the necessary resources to develop a public health-based tracing system for England too? Finally, Mr. Speaker, Chris Whitty said it isn't possible to open up everything and keep the virus under control. While it is really good to see deaths from COVID fall, new cases in the UK are currently higher than when we had to go into lockdown in March. So if getting children back to school is his government's priority, why are they pushing people back into offices at the same time?
Thank you very much, Mr. Speaker. I've addressed several of the points in questions already, and this idea that instead of the large-scale national system working together with the local contact tracers, that we should disparage one part of it and praise the other. This divisive approach that's proposed by the SNP spokesman is wholly wrong, and would lead to things getting worse, not better. Instead, we need to work together to improve the system, in the same way that the Scottish Government and the UK Government work together to provide a testing capability right across Scotland. On the question also of the arrangements in terms of the future of PHE, We look around the world at the best way to ensure that we have the systems at a national level that can respond to the virus, in the same way that we put in place the Joint Biosecurity Centre, where we work closely again with the Scottish Government, the Welsh Government and the Northern Irish Administration to make sure we have the best possible system, for instance, when cases move over the border. Some of the best systems in the world, like the German system, have an institute that is dedicated to infectious disease control. I'm absolutely convinced that with the enormous amounts of extra money that we're putting into health protection at the moment, that with that investment and with the extra support that's going in, and with the clarity and dedication of the new National Institute for Health Protection, that will be a step forward. And I pay tribute to all those who've been working in public health England and right across the board to keep people safe during this crisis.
John Morrissey.